Hello and welcome to the PJ Pod. And for this episode, we're coming to you from a beautiful National Trust site near Guildford, where I've come to experience a dose of nature. I'm Connelly, Senior Features Editor at the Pharmaceutical Journal, and I visited that National Trust site to hear about the work of a charity that helps people improve their mental well-being by connecting them with their natural environment. The charity is called Dose of Nature, and it provides a one-to-one psychology-led programme as well as weekly group activities.
You don't have to talk, there's no pressure, you don't have to talk about your problems. You can if you like, but there's no pressure to. You talk about nature, you look at flowers, plants, you talk about the benefits, basically, and it's just amazing.
Yeah.
And I do it every week.
This is Steve, who's been using the service for around 4 months. He kindly agreed to share his experience with me. Yeah.
Because I just needed something just to help my mind, you know.
We chatted in a wild but rather enchanting garden within the National Trust site. The sun was shining, the birds were singing, so you might hear a bit of nature in the background, and the odd aeroplane too.
Basically, I went through a bad patch in my life. I was with a partner for 27 years, and it all came crashing down, and that destroyed me, basically. I was depressed, anxiety, confidence just got absolutely ripped from me, and I found life so difficult. Yeah. I just didn't want to be here anymore. I found that was it for me, because that was my life. So that's the reason why
Steve went to see his GP for help. As well as prescribing medication, the GP referred him to a social prescriber, who got in touch a couple of weeks later to suggest that connecting with nature might be right for him.
Yeah, so she actually referred me to Dose of Nature.
Right.
And
okay.
I was scared. I didn't know what it meant. I didn't know what it was all about.
Yeah, I was going to say, how did you feel when
I felt
she
really
suggested that?
even more anxious.
Yes.
I was so nervous, and it's like, goodness me, what's this all about? But at the time, I thought, well, I need something. I just said, yep, I'll do it, even though I didn't really want to.
Yeah. And that was the beginning of Steve's enduring relationship with Dose of Nature. Psychologist Georgina Gold is the charity's clinical lead, and she joined us in the garden to explain a bit more about how the programme works.
And once people are referred by their GP, then they're initially seen by a psychologist. We'll do an assessment, as one might experience in any other mental health service. And then we support people to do two things. One is to spend more time in natural spaces, and the other is to really connect, to pay attention, to tune in to nature when they're in those spaces. So be mindful in them. And the way that we support people to do that after the assessment is through pairing them with what we call a Dose of Nature guide. These are all really lovely, compassionate, supportive volunteers who will meet their clients once a week outside in a natural space for 1 hour. The client and guide will form often a really nice supportive relationship with some shared experience, and the guide would be somebody the client can talk to. But actually their role really is to improve nature connection. And so they would do lots of exercise and activities that would support that. Things like mindfulness, mindful walking, drawing, creative writing, poetry, leaning against a tree, lots of different things.
As someone who feels the mental health benefits of getting out in nature myself, whether that's walking my dog or going for a run, I was keen to find out how being immersed in nature helps and if there's sufficient evidence for its benefits. Georgina explained that being in nature can have a physiological impact on our bodies.
When we spend time in nature and when we connect to nature, it has a really positive impact on our physiological kind of, response. So most people will have come across, especially your listeners, the stress response system, that fight, flight or freeze response that's activated when we perceive or are under threat. That stress response system, as your listeners may already know, has a really negative effect on our body. We release lots of adrenaline, lots of cortisol, and we go into that fight, flight or freeze mode to try and protect ourselves from the threat. A lot of our clients describe being in that mode when they come to us. They talk about feeling tense, not being able to sleep, not being able to concentrate or focus, not being able to make decisions, having problems with their indigestion. And actually what the evidence is showing us is that when people spend time outside in nature, there is something about what is around us that has a positive impact on settling that nervous system. So our blood pressure drops, our levels of adrenaline and cortisol drop, and that all enables what we call our rest and digest system to activate. So the system that enables us to feel calmer, to sleep better, to think clearly, frees up that kind of cortex, the top level that's responsible for our executive functioning, to be able to function more effectively. So that's one of the things that I think people would.
She also told me about the relaxing effect on our brains of fractal patterns, the self-repeating shapes found everywhere in nature, and about research that suggests chemical compounds called phytoncides, which are released from trees and plants, can boost our immune systems.
But there's a lot of evidence initiated by Japan, who are very into what we call forest bathing, Shinrin yoga. They have done a lot of research into the positive impacts of trees on our physical health. And what that research is showing is that when we breathe in those phytoncides, the numbers of natural killer cells we have in our bodies are boosted. Those are the white blood cells that are linked to immune system functioning. So actually, people's immune systems can increase. And as we know, when people are stressed, when people are worried, that does compromise the immune functioning. So we always say to people, get out into sort of beaches or, rolling hills, but try to be amongst trees and plants as well. Even have them in your homes.
Yeah. So it seems that being in nature has an impact in itself, rather than just doing a particular activity or exercise outdoors. And as Georgina told me, actually connecting with nature enhances this further. I'm sure that anecdotally that resonates with a lot of us, but I wanted to know more about the wider evidence base for this. So I got in touch with Ruth Garside, Professor of Evidence Synthesis at the University of Exeter.
So Joe Thompson-Kuhn and others did a systematic review some years ago now, which compared indoor exercise to outdoor exercise. So exactly that question, can you just run on a treadmill, or is running through the park better? And the evidence from that systematic review does suggest that there's an additional benefit from being outdoors. So yeah, there is a suggestion. It's not just the exercise, and it's not just the exposure to interesting stuff. There is something else going on with the nature-based bit.
I was curious to know whether there's a consensus among researchers on the strength of the evidence and where Ruth stands on this.
I think it's a really difficult question to answer, because different people have different understandings of what evidence is and what evidence is required to accept something is proven to be effective. I think there's lots of ways in which these different ways of interacting with nature are likely to be doing us good. But I think there are still gaps in our understanding about, well, how can we best support people to do that? Which groups of people do we think are going to benefit? Because again, there's a whole spectrum, isn't there, in terms of, is this a more public health preventative thing? Or is this something which is potentially actually therapeutic for people who have got, for example, anxiety or depression?
Georgina at Dose of Nature agrees that evidence about specific interventions is lacking.
I think there's always a call for more. I think there's a lot of evidence about some of those, what we call ingredients in nature. So the phytoncides, the fractal patterns, there's evidence around sunlight in terms of boosting serotonin, and vitamin D. But I guess the gaps in the research are more about how sort of programs like ours can have a positive impact over time. There is research out there into walking groups or one-to-one kind of walks with people, or being outside in nature. There is evidence about that, but not so much about those benefits of being supported by a program like ours and how that can improve mental health in the long term.
To address this, the UK government has been exploring what role nature-based social prescribing could have in improving the nation's mental health and addressing health inequalities. This sort of social prescribing, also known as green social prescribing, can include activities like community gardening, mindful walks, conservation volunteering and wild swimming. In England, a green social prescribing programme launched in 2021 backed by almost £6 million of government funding to test how to embed these interventions in mental health pathways. The programme, which has just been extended to March 2025, includes 7 test and learn sites, one of which contributed funding to set up Dose of Nature's Guildford Hub, building on the charity's work from its base in London's Kew Gardens. Findings from the programme were published last month, showing that it had a positive impact and was able to reach a broader range of people than many other social prescribing initiatives, including children and young people, ethnic minority populations, and people from socio-economically deprived areas. Ruth was part of the evaluation team.
Certainly with the monitoring data, we found improvements across the ONS4 wellbeing domain. So that's, how happy people feel, how anxious they are, whether they feel satisfied with their life and feeling that their life was worthwhile. So there were improvements across the board on those measures, which is really encouraging. And it was over 8,000 people that were included in that data pool. So it's quite a big data set.
The evaluation also looked at value for money. A full cost-benefit analysis wasn't conducted because of the complexity of the project, but a high-level look found that the average cost per participant was around £500. This compares favourably with other mental health interventions, such as cognitive behavioural therapy, which comes in at a cost of around £1,000.
And we also found that the sites were able to get matched funding and in-kind resources so that the money invested was more than doubled. So, for every £1 invested in this big programme, we had £2.42 as a social return on that investment. So again, it appears that this is a good bet, if you like, in terms of money invested. But again, this is an average figure across, a lot of activity and a lot of different need as well. But yeah, encouraging findings.
Ruth explained that data isn't yet available on whether nature-based social prescribing saves money elsewhere in the system, for example, on GP appointments or hospital admissions.
Yeah, so that's something that we don't have data on at the moment. There's currently an extension to this project going on, so the sites are doing some additional work, which we are also involved in evaluating, and that's one of the bits of data we're hoping to be able to get. But again, it depends on how easy it is to access that information from the system.
Although prescribing time in nature appears to be cost-effective compared with other mental health interventions funded by the NHS, there is a key difference. The NHS employs social prescribing link workers, but the interventions themselves are funded by the voluntary sector, and it's not clear how sustainable that model is going to be.
You're facilitating people out of the health system into voluntary sector. But at the moment, in most cases, funding doesn't follow the patient. So you're still expecting the voluntary sector to fund its own activities through their normal ways of getting funding, whether that's big national lottery funding or smaller charity funding or whatever. But then you're asking them potentially to take on additional groups and maybe people with additional needs that they need to train their staff in order to be able to support properly and so on. So I think there is a need for a more thought about what kind of sustainable funding models we need and what those might look like in order to ensure that the voluntary sector can carry on doing the brilliant stuff that it does.
And indeed, Georgina says that securing funding is a constant source of stress for the Dose of Nature team.
Yeah, so again, it varies across site, but in the main, we do have some CCG funding. We have charitable trusts. That's probably a big pot of our funding that's set up to provide funding for charities. In Kew, for example, some of our funding for our young people's programme has come from those trusts, private donors, and different kind of initiatives that are going on that are set up to support charities, and we apply for that funding, and it's a regular source of stress in a way because we have to keep the funding going, but we do have some really lovely relationships.
This lack of sustainable funding is also a barrier for healthcare professionals who might want to prescribe nature for their patients, according to Jules Alejandre, a health promotion and policy specialist at the University of Edinburgh. Jules worked on Scotland's first green prescribing programme for primary mental health care as part of his PhD.
Some of the healthcare professionals that I talked with when I was doing this research, they really, really want to do it. However, they're reluctant or hesitant to do it because they're not sure if that kind of intervention will still be there, because they know how unsustainable it is. It could end up in a year or after 2 years, for example. So it's very uncertain, and it adds to that kind of reluctance of healthcare professionals because they're not very sure if it's going in a longer term. What if the patients are really engaged with it already, or their health are really improving to it, and then suddenly it stopped? What would happen to the patient? It's like prescribing an antidepressant to the patient and then eventually asking them to stop.
One of the key learnings from England's Green Social Prescribing programme was a need for new commissioning and procurement arrangements to ensure that nature-based providers can be embedded within health service delivery. The evaluation report explains that this requires having more joined-up commissioning processes that would mean green providers can work together on funding bids.
There's a lot of short-term, potentially precarious funding. And, the way in which new funding is framed is often around novelty rather than, okay, well, we've just got this really great thing that we're doing and we want more money to carry on doing it. And in this new piece of work that we're doing and the extension of the Green Social Prescribing national programme, thinking about sustainable funding models is one of the targets of that as well. So hopefully there will be some systems coming up. And I guess there are some explorations around, whether some kind of pay what you can model might also be part of that in terms of the people who are being referred to help support those models. So I think there's lots of possible areas. The other thing that the sites have been doing is to try and, provide networks and link-ups for the providers within a locality to work together. So that could include potentially applying for larger amounts of money that could then be not just each individual organisation sort of in competition for the same funds, but actually working together as a network to try and get funding in that they can all use.
This piecemeal funding also prevents effective collection of data on patient outcomes, especially for smaller charities.
Most of the social prescribing intervention or nature-based social prescribing intervention that I know are very much community-based intervention. That's why how they measure it are actually very much different from one community to another. Most of it are actually led by third sector organizations, and some of these third sector organizations, they don't have the capacity to evaluate it robustly, even though they're actually implementing really good nature-based social prescribing. The crux is always on the evaluation aspect on how to report this, to really interpret evidence properly. So I hope we're going to invest more on how we're going to evaluate this kind of intervention.
At Dose of Nature, they've decided to team up with the London School of Economics to evaluate their intervention. Here's Georgina again.
So this is a project that will probably span about 18 months. We're gathering data that looks into our clients' levels of depression, anxiety, well-being, loneliness, community engagement, nature connectedness, pro-environmental behaviours, pre and post our intervention, and also 6 weeks follow-up as well. So we're really hoping that that is going to really give us some more evidence around how an intervention that is supported, that is psychology-led, but ultimately with the main ethos of trying to get people outside and connected to nature, we're really excited about the results that would produce. Mm-hmm. Our main aim is that everybody across the country could have access to an intervention like this as an alternative to psychological therapy and medication. And of course, as we know, for that to become mainstream, we need evidence. It needs to go in the NICE guidelines, and so we're hoping to in some way contribute to that path.
One way to make these initiatives more sustainable would be for them to be funded by the NHS. This is something Jules considered as part of his PhD.
One of the intervention that was proposed in the workshop actually was the possibility of making nature-based social prescribing publicly funded, like funded by the NHS. Basically, it's something that should be delivered by the NHS. So taking away that money from third sector organization and having the NHS implement it. However, if we're going to do that, we're taking the resources of this third sector organization and putting that to the NHS, and we're not sure if the NHS has the capacity to actually mainstream it or implement it in a wide scale. So you're taking away resources from this very small third sector organization. You're taking away jobs from some of their volunteers as well. So I think what needs to be done is to increase investment to community-based interventions, increase investment to make this kind of community-based intervention much more sustainable and support them more, provide them resources, provide them with the proper staff, provide them with proper training on how to deliver this.
I asked Ruth what she thought about the NHS footing the bill for nature-based social prescribing.
I think that's a really big question, but it's interesting to me that at the moment there's this drive for social prescribing where the voluntary sector is being expected to provide something which is potentially therapeutic, but without that money. So there is something that doesn't quite add up there. There have been some different models of how to do that. So there have been some models of the sites funding these activities directly, and along with that, there are some sort of evaluation benefits because potentially then you can ask for certain sorts of data to be collected as part of that, which again would help to build the case for whether or not this is an appropriate route. But I think, we all know there's very little money in the system. So I understand that there are many competing priorities.
Another aspect that would need to be considered if the NHS were to fund these interventions is regulation. Although charities have their own risk policies and insurance, they're not regulated in terms of the quality of what they provide in the same way that NHS services are. I asked Ruth if she thinks there needs to be some sort of regulation or accreditation of providers.
I think their organisations work with different groups of people, so the requirements for a community allotment, community garden, who are sort of basically an open organisation, anyone can come along. They're really working mostly in that sort of prevention end of the spectrum. Obviously has very different requirements to somebody who's working with people with more serious mental ill health and so on. So again, there were some models within the pilot, the national pilots, developing a kind of framework for organisations to put themselves on that sort of scale about who they were working with, who they were comfortable and confident working with, what kinds of training they had within that space, and then trying to offer a framework for the sorts of things that need to be in place for all of those different sorts of groups. And then that allowed link workers to have a kind of trusted list of people who they knew could work with specific organisations, specific groups.
So what would it take for nature-based social prescribing to become more mainstream across the UK?
I would say creating a robust partnership that creates evidence, local evidence on how effective it is. That's the first thing. Second thing is increasing investment on the socio-ecological determinants of mental health, for example, and that really talks about increasing investment to this community-based organization, providing this kind of intervention, creating a feedback mechanism between the NHS or the GP practice and the community-based organization. What kind of relationship should they have, and creating guidance on that as well is something that needs to be done. Basically integrating it in clinical guidelines or in, for example, managing diabetes, for example, managing mental health. Just mentioning the opportunity for social prescribing to be used is something that would eventually start the conversation on mainstreaming it more in the NHS.
Ruth would also like to see it within guidelines, but recognises that there are some challenges around that.
It would be great to see social prescribing and nature-based stuff in NICE guidance. We already have that kind of step-up approach for things like depression. And so, one of the first steps includes things like exercise and physical activity as a way through. And I think, Green social prescribing may fit very well as that kind of level of treatment. So I think that would be really good. But then we're back to the question about what kind of evidence do you need. Obviously the NICE model is around trials, systematic reviews of trials, cost effectiveness evidence, and so that's at one end of the kind of evidence that may still need to be developed for it to be included in that kind of framework. But I think there are also, there's the changes around now of the way NHS services are going to be managed and organised locally. So the ICBs potentially have some of that flexibility to think about who they want to be working with within their locality. And so making sure that this is recognised as an option at that level, I think is also really important. I think, as with any relatively new thing, you still need champions, don't you, to help people understand what it is and what it might be.
One of these champions within pharmacy is Dimple Kateri, a mental health pharmacist and personalised care lead at a primary care network in Hertfordshire. She works closely with the social prescribing link workers within her network, attending weekly meetings to discuss patients, and even having joint appointments with some patients to make every contact count. She's referred several patients to social prescribers who've connected them with nature-based activities, but one in particular sticks in her mind.
So I'd been working with her for about a year, just sort of trying to optimise her antidepressants. Unfortunately, she had developed a reaction to an antidepressant that she had been stabilised on for around 30 years. So we had to sort of look into other alternatives, but unfortunately she wasn't getting any better. Really in a debilitating state of mind, lost all independence because her anxiety was quite crippling. So despite medications not particularly being effective, we then took the decision to refer on to a social prescriber, and we offered her joint appointments together, initially both with her and her husband. And we had discussed various things with her in terms of, sort of nature-based walks. But one of the main interventions that the social prescriber has suggested to her was based in the woodlands, where the patient has to be barefoot and have their feet connected to the soil and to the ground to really try and help stimulate the brain and to be able to, release those positive endorphins. Initially, she wasn't receptive to it because there was a lot of fear around going out, particularly by herself. So the social prescriber was able to support her with that and go with her to the first appointment. And then, thereafter, she's been able to sort of manage going on her own and found it beneficial. And from her own words, she didn't think that this was something she would have even come across had it not been for us introducing it to her.
This lack of understanding and fear of the unknown, as articulated earlier by Steve, is not uncommon. But Dimple says with the right information, it's possible to break down some of these barriers.
Some people will not particularly understand the concept of social prescribing, so there's fears that it's a social worker I'm referring them to, or that they'll be getting prescriptions for something else. And I think it's still a new concept for people to understand that there is a non-medical role to help them manage their health and well-being. It's not just clinical and it's not just based on the medical model. And I think once you're able to give a clear definition as to what social prescribing is, how it can benefit a person's well-being, physically and mentally, then I think that does start to break down a little bit of the barrier. But I think we still have this culture where patients do expect medication, unfortunately.
That's why Dimple believes pharmacists are in a great position to talk to patients about nature-based social prescribing when they're reviewing or answering questions about medicines.
Pharmacists can certainly, I think, feel confident to suggest nature-based interventions alongside whether it be antidepressant treatment or cognitive behavioural therapy. Again, like I say, for those people who do perhaps have that motivation to wanting to go out, and encouraging them to engage in nature-based intervention, because I think it then creates this narrative that medications play a small part to managing symptoms, and actually, it's the doing as well, not just as much of the taking of medications, but it's the active doing as to, going out to, whether it be nature-based interventions, it could be going to sort of water-based interventions. But I think it's just having a different approach to people's treatment and care, which I think pharmacists are in a good position to be able to do.
And for some patients, it has a profound impact. What would you say?
I'd say it's given me more confidence. I'd say it's given me, I don't really worry about too much anymore, because at the end of the day, it's no point, because it's no good worrying you. Live for today.
Yeah.
You can't worry about yesterday, because yesterday's gone, and you can't worry about tomorrow because it hasn't come yet. So live for today.
Yeah.
Basically, it's changed my whole outlook in life. Basically,
Brilliant.
I'm more happy with myself.
Yeah. Fantastic. Wow. Brilliant. Thanks so much, Steve, for sharing.
So how did that go?
It was
Do you think that was
brilliant.
okay?
Yes, definitely, yeah. Clearly, interventions to encourage people to connect with nature can be really beneficial for some struggling with their mental health. And with a significant rise in people experiencing mental ill health in recent years, at an estimated cost of £300 billion per year in England, there is plenty of demand. But there are still pieces of the puzzle missing. More research is needed to pinpoint who nature-based social prescribing helps the most and who it doesn't. Prescribers and link workers also need more high-quality data on specific interventions so that they can be confident that the schemes they're sending people to will benefit them. Of course, in the end, it all comes back to funding. To fully embed nature-based social prescribing within the NHS, the charities need to be nationally commissioned with proper investment to continue providing these interventions. Until then, service users like Steve are in the precarious position of having the treatment that works for them available one day, but gone the next. This episode was produced by Jeff Marsh and presented by me, Dawn Connelly, with support from Carolyn Whitware. A big thank you to all of our contributors, Georgina, Ruth, Jules and Dimple, and especially Steve for sharing his story. And finally, thank you for listening. This episode of the PJ Pod is part of our October issue. The PJ Pod is brought to you by the Pharmaceutical Journal, the official journal of the Royal Pharmaceutical Society. And just before I let you go, if you're interested in joining the Royal Pharmaceutical Society, to access a range of member benefits, including the Pharmaceutical Journal's news, features and learning resources, you can do so for the equivalent of just 60p a day. Just search RPS membership to find out more. See you next month.